Okay. This is our case study focused PDSA. I'm Holly.
And I'm Rachel.
All right. So for finding a process to improve, ABC Medical Center patients experience delays during scheduled visits due to lab errors, physician and provider errors, and patient room errors. The opportunity for improvement is patient experience and quality of staff at BloodWorks Incorporated, and also to decrease the number of lab errors at ABC Surgery by the surgery staff. And we have all of this information displayed in a table over here from January 1st, 2015 to March 25th, 2015. So the total number of patients is 70. The number of delays caused from lab errors is 15. The number of delays experienced is 25, and the percent of delays experienced is 35%. And then the team who understands this process consists of an orthopedic surgeon, the phlebotomist, pre-surgical nurse, clinic nurse, surgery staff, chief medical officer, and the medical director. And we have in this table their name, email, and all their roles. So the current knowledge that we have regarding this case is that Eddie is having elective knee surgery. He must have blood work, an EKG, and other tests for surgical clearance. Eddie chose the phlebotomy site closest to his home, which is BloodWorks Incorporated, and he arrived here on April 8th, 2015 at 7:30 a.m., and he was called for the blood work, or the blood draw at 7:45 a.m. And then the phlebotomist is confused about which labs to draw for Eddie's procedure. So after 10 minutes of searching through unorganized papers and binders, the phlebotomist and nurse who was helping her locate them found the correct labs and gathered 4 test tubes from the supply room, which was down the hallways from the room that they were already in. And then after waiting another 20 minutes, the nurse reviewed Eddie's history to find the test to be performed and completed a test requisition. And Eddie's blood draw was not actually completed until 8:30 a.m. Next, the surgery staff verified that all the pre-op was complete and the patient was ready for surgery. And then 2 weeks after the initial blood draw, Eddie arrived in the surgical area at 6 a.m. for registration. And then at 7 a.m., Eddie was informed that his lab test had insufficient blood quantity in the tube, and he was told that the test must be repeated and that the surgery would be postponed for at least 1 hour. And then understanding the root cause. So the problem is that the patients are experiencing appointment delays, and there are several reasons for this. One is that there are insufficient labs drawn or the wrong tube was used. And second, the physician or provider was not in the room. And third, the patient's room was not set up accurately.
So for selecting the improvement, we're going to hold biweekly staff meetings with departments to review the number of delays and then hold time for group discussion. So here we've got all of our options that we have, and we rated them on a scale of 1 to 5, 1 being best and 5 being worst, and staff meetings and discussions had the lowest total. So what's going to happen at these staff meetings is that there will be a review of the number of delays overall, and then a breakdown of the number of delays caused by each department. There will be incentives in place for the most improved department, and then if a department doesn't cause any delays, staff members will also anonymously vote on suggested items such as extra training or refresher courses. That way they can determine what they feel would be most beneficial for them to complete their jobs without error. So our plan for the improvement is implementing biweekly staff meetings. We're going to interview at least 3 staff members on ideas to discuss at the first one. We're going to email all invited staff members to determine the best date to hold the first meeting. We're going to create an outline for topics. We're going to discuss incentives to attend, and then we're going to create standard objectives to go over at each meeting, and then hold a vote at the end of each meeting to determine if additional training is needed. Our second objective is going to be to measure the staff competency and motivation. So we're going to create an anonymous survey and send that survey to all staff members. We're going to give an incentive to complete the survey and then close the survey after 2 weeks. That way it's completed in a short amount of time. We're going to review the results and discuss them at the staff meeting. Then we're going to hold brainstorming sessions with the staff members on how to improve or maintain the confidence and motivation at the hospitals or clinics. So to do the improvement, these are our results, weekly results over the first month. So there were no significant results, but the data is trending towards the goal of only 5 appointment delays per week in the first month after the the improvement strategy has been implemented. So our next steps are to obtain staff feedback on meetings, give staff feedback on the number of delays, and then set new goals for the next month. In our study of the results over a 3-month period, no significant results, but the data is still trending towards a goal of 0 appointment delays. These results are showing that our changes are effective, but there are still barriers to reaching our goal. After a 6-month implementation period, we expect there to be a significant decrease in the number of appointment delays.
And then for the ACT, we have some future steps. So one would be to create a staff panel so that problems can be addressed collectively with all the staff to kind of talk about their experience and what they've seen. And then 2 other shorter term future goals that we have are to adjust the meeting topics and voted items accordingly, and then to continue with group discussions like we have, and the staff votes as well.
So that is our PDSA.